Hello, my name is Oka. I'm a spokesperson for Otsuka America Pharmaceutical Inc. In the next few minutes, we're going to review the disease of schizophrenia from a perspective that directly matters to you. Your organization probably has experience providing health benefits for patients with schizophrenia. So you may know, schizophrenia is characterized by different symptoms. One associated feature of schizophrenia that may be present in some individuals through the course of the illness is a patient's lack of insight into his or her disease. Management of schizophrenia can include multiple services, including a treatment team, pharmacotherapy, hospitalization, and more. Combine that with the need to individualize each patient's course of therapy, and you begin to understand how schizophrenia can be a resource-intensive mental illness. In short, schizophrenia is a severe and disabling brain disorder that can be challenging and costly to treat. This video is a short review of the disease, its symptoms, and why it can be challenging and costly to treat. According to the latest edition of the Diagnostic and Statistical Manual of Mental Disorders, the DSM-5, schizophrenia involves, quote, a constellation of signs and symptoms associated with impaired occupational or social functioning, end quote. Experts think schizophrenia may be caused by several factors, including probable interactions between a person's genes and his or her environment, and possible differences in brain chemistry and structure. A large retrospective analysis published in 2006 estimated that schizophrenia is most prevalent in patients between the ages of 46 and 65. In this study by Wu et al., the prevalence of schizophrenia was calculated as the percentage of individual enrollees with at least one diagnosis of schizophrenia, including spectrum disorders within the ICD-9 code of 295XX. The prevalence for privately insured individuals was calculated from an administrative claims database of approximately 3 million privately insured beneficiaries from 1999 through 2003. The prevalence for Medicaid enrollees was calculated from California Medicaid claims from 2000 through 2002. The prevalence for Medicare and Medicaid-Medicare dual eligibles was estimated using a combination of both databases. The prevalence of schizophrenia spectrum disorders was estimated to increase in the late teens and 20s. The prevalence of the disease was calculated to be slightly different between males, shown in blue, and females, shown in red. The highest prevalence for men with schizophrenia was between the ages of 46 and 55. Peak prevalence in women was estimated to start and end later, with the highest prevalence between the ages of 56 and 65. There is no single course of illness that any particular patient can be expected to follow. The course of schizophrenia is variable. After their first episode, many patients with schizophrenia are unable to return to a level of adaptive functioning as high as before the onset of the disorder. Adaptive functioning is the relative ability to effectively interact with society on all levels, and to care for oneself. In schizophrenia, deficits in adaptive functioning can include difficulties in performing activities of daily living and problems maintaining employment. It's important to note that symptoms of schizophrenia involve a range of cognitive, behavioral, and emotional dysfunctions. In the DSM-5, these symptoms are divided into 5 diagnostic criteria. Criteria 1 through 4 include symptoms such as delusions, hallucinations, disorganized speech, and disorganized or catatonic behavior. Diagnostic criteria 5 include symptoms that reflect a lessening or loss of emotional expression and fluency of speech, as well as avolition or a lack of goal-directed behavior and drive. One of the possible associated features of schizophrenia is anosognosia. This feature is more commonly known as poor insight. Poor insight may prevent those affected by the disease from recognizing the need for treatment, which in turn may predispose those with schizophrenia to treatment non-adherence. Some individuals with schizophrenia have poor insight when it comes to actually recognizing their psychotic illness. It's important to note, for patients with schizophrenia, poor insight is a manifestation of the illness. It is not a coping strategy. Poor insight is predictive of higher relapse rates, increased involuntary hospitalizations, poor psychosocial functioning, and a poorer course of illness. In a study of medication non-adherence as well as psychological, behavioral, and family interventions, treating psychiatrists reported that most of the therapies tried were significantly less effective among patients who lacked awareness. In addition, poor adherence can hinder involvement in rehabilitation programs and may lead to the debilitating effects of repeated relapse and rehospitalizations. Considering these disease characteristics, schizophrenia can be a difficult disease to treat. Thought leaders recognize the need for multiple therapeutic options in the treatment of schizophrenia. From continuity of care, to medical adherence, to clinical intervention, to overcoming practical barriers to adherence. Clinical psychopharmacologists increasingly realize that it is highly unlikely that we have a magic bullet to treat adequately all aspects of schizophrenia in the foreseeable future. Rational polypharmacy may be the trend for the next decade. Quote, formulation and periodic reevaluation of the treatment plan at different phases of implementation and stages of illness are essential to good clinical practice, end quote. As you have seen, to help provide the best possible outcomes for your members with schizophrenia in a cost-effective manner, care providers need timely access to the full range of treatment options available.